So I must congratulate Kovai Post for starting this news portal. Another reason for making Coimbatore well known in the country and I hope internationally also. Well, Coimbatore is not just known for its industries and its textiles, but in the recent years, it's becoming a destination for healthcare. Better and better hospitals are coming up in the city, and we at Kovai Medical Center and Hospital are proud that interventional radiology is a center of excellence at this hospital. Now, what does interventional radiology mean? It talks about, or it includes, a large number of procedures that really does not require surgery. In other words, at some time we used to do a major surgery, and today we can achieve similar or better results by taking small tubes called catheters from a small puncture in a blood vessel, often in the thigh. We use imaging equipment like the one that you can see behind me to actually see these tubes as we navigate them across blood vessels in the body. Let me give you an example. A patient comes with a bleed into the brain. We do an angiogram which is very, very similar to the one that is done for the heart, and we can actually see the area of bleed which presents as a bubble. Right on the screens like the one behind me, we can see it in 3 dimensions, and then we can navigate a tube and block that bulge alone using coils and stents and cure the patient of a major problem which till a few years ago would have required an extremely complex surgery which would actually involve opening the brain and placing a clip inside it. Bleeding in the brain can be for some other reasons. For example, sometimes it's because of an abnormal cluster in the blood vessels called an AVM. And today we actually take a tube into that cluster and we inject a medical glue into it, destroying that completely. What is even more exciting, that in the recent years, we today have devices to remove a clot that blocks a blood vessel which results in stroke. So today, if a patient can come to our center within the first 6 hours of a stroke, we can actually remove that clot and try hard to get that patient to go back walking again. What is wonderful about interventional radiology procedures are they require very, very small hospital stays. We do a procedure without using a knife, and that's why it's called cutting edge technology without the cutting. So since there are no stitches involved, patients are often discharged within 24 or 48 hours and they get back to work again. The procedure is just not limited to the brain alone. We treat blocks in the blood vessels in a similar way. A patient with a block in the blood vessel of the leg would actually come with pain when he walks, or in a diabetic patient can come with an ulcer which does not heal. Once we re-establish flow down the leg, we can actually enable the ulcer to heal and we can save that leg. Sometimes a block can be in the kidney, and here the patient will present with increased blood pressure. If it is in the blood vessel that supplies the intestine, he complains of severe pain when he has his food. And all of them can be treated by using interventional techniques which is called angioplasty and stenting. Interventional radiology at Coimbatore is also well known for another pioneer activity, and that is in the treatment of cancer of the liver. We take the tube to the very blood vessel that supplies the cancer and we inject a radiation material right into the tumor, and thus the tumor is destroyed without any side effects alone. It is amazing techniques, phenomenal form of treatment which can actually give several years to to a patient with liver cancer. There is just one more area which I would like to highlight, and that is the treatment of bulges in the main blood vessel of the body called the aorta. These are treated by stent grafts, which is a mesh onto which a fabric is loaded, and these again are big surgeries if done in the conventional way. And today we treat them just by stent grafts, or we work closely with Dr. Prashant Vaijanath from cardiothoracic surgery, where we actually ask them to do part of the surgery, and then we would also do this interventional technique, and these are called hybrid procedures. Women often present with fibroids. It is so common that nearly half the women in the world have them. Conventionally, the uterus is removed for this. Removing the uterus in a young lady has its own problems. Very soon the ovaries stop functioning. They actually feel older and metabolically get older. Even these today can be blocked by taking fine tubes and taking the blood supply to the fibroids off, allowing them to shrink. A similar treatment today is also available for an enlarged prostate gland. This department also has done pioneering activity in the treatment of varicose veins, a very common problem, where we actually take a fine electrical cable which gives radio frequency which can actually burn it down. So in conclusion, interventional radiology provides a patient with a vast array of procedures, all of them extremely non-invasive, all of them involved with very, very little pain and very short hospital stays. And we are absolutely excited about the fact that Coimbatore is today considered a mecca for interventional radiology procedures. When I started this department 25 years ago, people were wondering whether a two-tier city like Coimbatore could really be a center which could sustain the specialty. And today we are happy that not only could it sustain, but we could prove that excellence in whichever part of the country is always recognized and appreciated. And once again, I would really want to thank the press and Kovai Post to have us talking about this right within the first month of their launch. And I wish that this portal is really popular and will continue to do this good work in educating the people, not just about current events, but about topics which can actually have a benefit for them in their everyday lives. Thank you.